Now let's talk more about sympathetic nervous system again. So this is also a common misconception. When we think about sympathy, the word sympathy, we think about something very nice, and we think of something who's kind of like being empathetic. We think of it as a positive word, but we also think like, oh, sympathetic is very stressful too with these fight or flight situations. So the thing is that sympathy is that is like a symphony. You play together and a lot of instruments playing together. Patho, like in pathology, refers to suffering or feelings. So when you express sympathy, you're saying you're feeling the same emotions together with someone else. You're suffering together with someone else. So that's where that sympathy, the nice version of sympathy, but sympathetic, this is where they name the division. They're saying like all of these organs are suffering or feeling together. So this is why sympathetic division is a coordinated thing. It's not just pick and choose which organs are activated or downregulated. You're all having these organs suffer together. But again, it's not necessarily something negative. That's also a common misconception. Just like the exercise. So that's why I like to use exercise as an example. Because why? When you exercise, what happens? Well, your heart rate increases, your breathing increases, your metabolism increases, you start burning up your energy stores, and you also, are you thinking of when you're doing like going for a jog, are you really thinking of using the restroom? Probably not, right? So the thing is that with the sympathetic, it's not necessarily something that's negative. It's just showing you that's a coordinated response. And another way you can think of it is like gas and brakes. Like you have to use both to drive your car. I mean, if you're very skilled, maybe you can decelerate using turns or whatnot, or try to try to use inclines or declines. But you have to use your gas and brakes when you're driving, right? So you can think of like sympathetic as go time, and parasympathetic is like, let's slow down, let's break things. So or not break things, like break things, put the brake on things. But the funny thing about your body is sometimes it's like those drivers, I don't do this myself, but I've heard of drivers where they somehow have what did they teach you in driving school? Like, don't have your foot on both pedals at the same time. Well, your autonomic nervous system is kind of a driver that uses both at the same time. So sometimes if you're pressing the gas pedal harder than your brakes, then you're going to accelerate, even though you're not completely efficient. But say you have your gas on and then you have slight brakes and then you let go of the gas. Then the brakes kick in, right? So this is the interesting thing about your autonomic nervous system. It's kind of driving with both pedals at once. So yeah, we have all of these over here, and this is why I love the exercise example, because what do you do when you exercise? You also sweat as well. And let's see, so here we have our ganglia and postganglia, and yeah, so just to recap right here, sympathetic nervous system, preganglionic are shorter, but postganglionic is longer. Parasympathetic, preganglionic is longer, and then the postganglionic are shorter. So what we have, a ganglia are closer to the target tissues. Sometimes they're actually contained within the target tissue, so this is what we call intramural ganglia, when they're actually inside these tissues. Now, the interesting thing is that compared to the synapses, like these, remember our axon terminals and telodendria. So we have a typical synapse over here, but postganglionic fiber. What we have is that compared to this synapse over here, we have these very interesting sort of what we call varicosities. So what they do is kind of like they have all these little vesicles that contain neurotransmitters. But instead of like having it directly on here, what they kind of do is like almost like a crop dusting. So what they do is that when you have activation of these postganglionic fibers, all these little varicosities, these little swellings, they're going to release their neurotransmitters onto the target organ and tissues. And here we are. So these are varicosities and all these vesicles. So when you activate these postganglionic fiber, it's going to like spread all these, sprinkle all these like neurotransmitters alongside these or all along the surface of these target tissues. Now, ganglia, so let's talk about ganglia. Ganglia gang. Alright, so sympathetic chain ganglia. So this is an interesting layout of this. So it's just showing you, this isn't anatomically like showing you in proportions and especially in size and layout, but it's just showing you the three type of ganglia you have in the sympathetic division. So the sympathetic chain ganglia, so we're looking at this cross-section of the spinal cord. So pretend you took the spinal cord and turned it toward you and kind of like, so you're kind of seeing from top down, or maybe a top-down version of the sympathetic spinal cord. So towards the side of the spinal cord, you have the sympathetic chain ganglia. So this is what we have here, the chain ganglia. So they look like those, I have one of those like chains, but you've had like those like long, like shiny metal ball chains, like the lanyards, whatnot. Or like if you go to the bank and you see those pens that are hooked up to those chains, they look like little strings of beads on a chain, right? So the chain ganglia are like that. And they're also called the paravertebral ganglia because they're right to the side. So again, para is a common prefix meaning to the side. So these are ganglia all arranged along the sides of the spinal cord. Okay, so another way I like to think of it this way. So if you, when I was a freshman, I also dormed in the Aloha Towers, and what usually happened, and it was so annoying, especially like somebody, they think it's so funny, they pull the fire alarms. So what happens when you have an emergency and fire alarm? Well, they pull the fire alarm, or say there's an actual emergency. You pull the fire alarm and all the alarms go off on every single floor. And this causes a big, the building-wide response that responds to this emergency. So I like to think of it this way. Like if you look at the anatomy of at least the chain ganglia on the sympathetic nervous system, they kind of like look like a little beads over here. So I like to think of it as the little floors of this building. And the thing is that with the sympathetic nervous system, we say it is a fight or flight situation. This is something you need to do immediately. You need a fast response. So it kind of makes sense that you want something that's coordinated and has a very quick first step so that you're able to initiate a whole system-wide response to whatever situation you have right there. So that's one key thing with the difference between the sympathetic and parasympathetic nervous system. With sympathetic, you can't really pick and choose. All those activities I mentioned in that list earlier, they all happen at once. So this is one thing with the sympathetic nervous system. Just like that building where all the alarms go off and you have an entire coordinated movement, same with the sympathetic activity. You have the increase or decrease activity of all of these organs. Now, with the collateral ganglia, what we have, instead of being the chain ganglia we saw over there, these collateral ganglia, they are, so the interesting thing is showing it that these roots are going toward the front. So this is actually toward the anterior of the spinal cord over here. So these are the types of the three main ganglia over there, the celiac, superior mesenteric, and inferior mesenteric. So these lead, the postganglionic fibers, these lead to all these abdominal pelvic organs over here. Now, what we have here is how it actually looks like in real life. So even though it looks like it's off to the side in this figure right here, if you actually looked at the back, this is all the way from like the OG Gray's Anatomy, but this is where we have all the ganglia. So this is in the back of the, just before the vertebra right here. So you don't actually see the chain ganglia on this one, but this is just showing you how it looks like in real life. It's not actually off to the side. Main point here is that these are very important for digestive organ or sympathetic control of the digestive organs. Now this is where this figure gets a little confusing. It's saying like, okay, the adrenal medullae. So what we have here is that these preganglionic fibers, but they don't actually synapse in a ganglia. They actually go right to the center of our adrenal glands. And you might be like, wait, what's an adrenal gland? Well, these are your adrenal glands. So they sit right on top of your kidneys over here. So they're superior to your kidneys. You have two kidneys, and you also have two adrenal glands, on the left and the right. And what we have, and this is actually something good to know in general, especially if you're continuing on to PHYL 142. Whenever you have a cortex and a medulla, the cortex is on the outside and the medulla is on the inside. Kind of applies like, cerebral cortex, that's the outer layer of your cerebrum, right? Medulla is kind of inner, more inner, but yeah, for other organs and tissues, if there's a cortex and medulla, cortex on the outside, medulla on the inside. Same with the adrenal glands. So the adrenal medulla is in the middle, they're in the center of it. Now, remember our preganglionic and postganglionic fibers. So we have our ganglion and our preganglionic fiber, and our postganglionic fiber is going to innervate our target organ. Now, that is typical of the sympathetic nervous system, but the adrenal medulla is special. So it's a put a little asterisk, put a little highlight. This is very important difference between the two. So in the adrenal medulla is that preganglionic fibers, they don't actually stop at a ganglion. They actually go right to the center of the adrenal glands. So they directly innervate the adrenal medulla. There is no ganglion. So the interesting thing about the adrenal medulla cells is that they're actually modified postganglionic cells. So they're, instead of having postganglionic cells, they are the cells that produce these neurotransmitters and hormones made by the adrenal medulla. So the interesting thing is that these neurotransmitters usually secreted by postganglionic fibers are epinephrine and norepinephrine. Well, instead of actually secreting these onto yet another tissue, these are going to secrete, if you have preganglionic activity, this is going to trigger the production of these neurotransmitters or these chemicals, epinephrine and norepinephrine, by the adrenal medulla. Okay, so this is big difference between adrenal medulla. So no ganglion. There's no ganglion, there's no collateral ganglion. It's just preganglionic straight to the medulla. And instead of postganglionic fibers, you have the adrenal medulla cells. Now, which specific cells? That's more for like if you're taking med school. But again, this is a big difference between the sympathetic typical sympathetic preganglionic and postganglionic versus the innervation of the adrenal medulla.